Dr. Lai, I think another factor that played a role in my diagnosis is somewhat being delayed is my age. I was 24 at the time. What are some questions others who suspect they have AML should ask to rule out the diagnosis?
So Sasha, that's a really good question. And what I would say is that as you are aware, the median age of AML diagnosis is 68. So not to say that we don't have young patients. I have plenty of young patients, but it doesn't come to, it's not a common thing to think about in younger patients right off the bat. The other thing that contributes to that is also AML compared to other cancers is an uncommon cancer. Mm-hmm. There are only, 25,000 cases of newly diagnosed in the United States per year. Because it's not as common in younger patients, and because it's not that common, doctors often want to rule out other simple things rather than just going straight to a cancer diagnosis. So unfortunately, that can lead to some delays. What I would say in young patients who are healthy is that they shouldn't have low blood counts that can't be explained for other reasons. So I think having prompt attention in terms of, if their blood counts are abnormal, to really understanding why they're not abnormal. And those are things that can be easily worked up. And if all those things are ruled out, then you're talking about doing a bone marrow biopsy. I don't like to do procedures for unnecessary reasons, but it's one of those things that you can also, I think if you have a physician who is astute and is thinking about that you can get to a diagnosis pretty quickly. AML is a diagnosis. It's in the name acute. It comes on acutely. So that means days to weeks. So I suspect you are probably feeling very well, and over a very short period of time felt very unwell, and you're very in tune to your body. And that is very important because patients are smarter than we give them credit for. And so being persistent and knowing that something is wrong goes a long way. Again, I'm sorry that you had to deal with that. And I'm glad that they finally made the right diagnosis. But I think just awareness and education, while it is, an uncommon disease, I think having, there's a larger burden and strain that happens on younger patients because, you haven't been working for the majority of your life, and it takes a huge toll on what your potential is, both as, a person, but economically and all sorts of things. So it's a huge problem.